So this is Terry Crow. She's a patient who has graciously agreed to do a video chronicling her rotator cuff repair. She's had one before, and now she's back for her second one. A little bit about her: she is a school teacher. This particular rotator cuff repair was a small one, so she started physical therapy a little bit earlier than often they do. She started a couple days after surgery. If it's a bigger repair, they'll end up, the doctor will have you wait about 2 weeks before you get started. So I'm going to ask her some questions, and she's going to give you some honest answers about what you need to know following rotator cuff repair. So Terry, let's talk. Tell us a little bit about what sleep is like after a repair.
Sleep is very difficult after repair. It's the first time I had it, I didn't have a recliner, and I tried to set myself up with pillows, couch pillows, and that sort of thing. That didn't work at all. This time I had a recliner. It was a little bit better, but it's still really hard. You've got your sling. This is hot and kind of cumbersome, and you just don't sleep well for about the first 2 weeks. I've just now started kind of getting a night's sleep here and there without waking up all the time.
And you're about 2 weeks out?
Yes.
Okay. What about pain medication? How much did you take? How did that go?
I'm not a pain med person at all. I don't like to take hardly anything, so I was really careful about taking it, but I had to take it every 5 hours. I took it every 5 hours until just day before yesterday. I took a pain pill last night to help sleep, because like I said, you're still not sleeping well. But every 5 hours for about the first 9 days.
Yeah, I mean, this is a very painful surgery often, and people need to take it. I try and get them off pain medication about 2 weeks, but I mean, it does take that long to get off of it, and people need to know that.
And like I told you before, make sure that you don't let the pain get out from under you. I mean, if you're taking your meds every 5 hours, don't think, well, it doesn't hurt that much right now. I think I'll wait a few hours, and when you do that, then the pain's out from under you, and it takes a while to catch up.
Okay. Talk about the sling a little bit. What's it like? How are you managing the sling?
Okay, the sling this is not the same sling that I had the first time. This one's really, really rough. It's very cumbersome. It's heavy. It's hot. It's real easy to want to just kind of slip it over your head and go. Yeah. So you need to keep it on. John and I were just talking about yesterday. I went to the refrigerator to take something out, and I found myself holding a kettle of beans without my sling on, without anything. I'm not supposed to be holding anything, so you have to make sure that you keep your sling on to remind yourself not to do things you shouldn't be doing.
And now I will tell patients, if you're sitting down on the couch and your arm is supported, you can be out of the sling. That pillow that is supposed to be in her sling but is not today, you need to keep that in, especially for these bigger repairs. Okay, talk a little bit about hair, showering, getting dressed, things like that.
Well, as you can see, not a lot done. You just have to kind of let it go for the first couple weeks. You just have to. I'm lucky that I teach school, so I don't have to get out and get dressed and get going. But it takes a long time to get your hair done, ladies, makeup on. You're not going to do it the way you usually do it, and you're not going to do it in the time frame that you usually do it. So you're just going to have to be okay with that for a couple weeks.
And you do, your husband has to help you. People need someone.
Oh, absolutely, absolutely. Up until yesterday, my husband was helping me shower. I mean, he was standing right there making sure that I didn't move my arm. You have to bend over in the shower, make sure you don't try to lift your arm, because you can lift it, but that's not good for it. So you just have to always be mindful that it's supposed to be in this position for a while.
So you're going to get your stitches out today.
Today, this afternoon.
What about, let's finish out talking a little bit about physical therapy. Let's talk about physical therapy in the clinic. How painful is it? What should people expect? What do you think?
Well, like I told John, this is the place to come for physical therapy.
That was unsolicited, I promise.
Having been here before, I have a friend who just had rotator cuff surgery right before I did, and I talked her into coming here because it's just such a great place. I mean, not only is it clean and modern and, you know, all that. It's just the idea of coming in and, you know, you don't know what to expect, and there's all this machinery and all these people. The people take you right in. You get to know everybody. They get to know you. It's pretty scary at first, and it really hurts a lot at first too. These first couple of weeks really hurt. But after you start coming, I look forward to it. I mean, I really enjoy it, just because it's like coming to see friends. And, you know, I mean, they're real, cheer you on, and, you know, if you're not doing the right thing, you know, I've had my hand smacked a time or two, but it, you know, it's just really, the physical therapy part of it is the best part. I mean, it's just you get your, this is where you get your, see that you're doing better, and, you know, you leave thinking, yeah, I can do that, that's okay, I'll have that ready for next time.
Last question. What about the PT at home? I've given you some exercises. Do you have any feedback to give people out there for the exercises at home?
Actually, just like the first time that I did this a couple of years ago, if you don't do your PT at home, then you may as well not even be coming here, because it's not gonna do you any good. You have to do the PT. Now, here's the thing: if 30's good, let's do 50. No, that's kind of my rule of thumb. Is, oh, if I could do 30, I bet I could do 50. Well, then you don't move, you know, the next day. So exactly, they tell you exactly what to do. They'll give you a paper with everything written on it. Do what the paper says. Don't do more, don't do less. Make sure that you keep up. John and I were talking earlier about some of the exercises seem like, really?
They're very easy.
They all have a purpose, and you'll see how it all builds in as you go on through your physical therapy journey.
All right, thank you. Well, if anybody has any questions that's watching this video about their experience or what to expect after rotator cuff repair, don't hesitate to send us some questions or comments. And thank you, Terry.
Sure.